I'm getting notices that my headphones are about to die. All right. Well, it is 7:03, so we'll go ahead and begin. Hello, everybody. Thank you for attending the CSRT Student Committee, part of their kind of speaker series. My name is Will Morgan. I am the program director of the Diagnostic Medical Imaging Program at City College of San Francisco. And today we have the pleasure of having Miss Rachel come speak with us. A little bit about Rachel. She is a board certified radiation therapist, an educator, and a dedicated advocate for the profession. She studied radiation therapy at Wayne State University in Detroit, Michigan, and then she did her clinical career here in California. While here, she specialized in the treatment of non-melanoma skin cancer using superficial radiation therapy, where she was able to treat more than 2,000 cases and becoming a national resource for education and advancement in IG-SRT. She's now based in Tennessee. She serves as the clinical recruitment coordinator for SkinCure Oncology. And while she no longer treats patients directly, she travels nationwide to educate providers, supports students like ours, and advocates for the advancement of radiation therapy. Rachel remains active in professional community through her involvement with both the Michigan and Tennessee Societies of Radiologic Technologists. She also co-published an article in Radiation Therapist, the APRT Special Edition, on the advanced practice role in IG-SRT. She remains active in the professional community through speaking engagements such as this, mentorship, outreach, and a strong focus on education and increasing visibility for the radiation therapy profession. So without further ado, I'll go ahead and introduce and welcome Miss Rachel.
Thank you. Makes me sound so good. I love whoever wrote that for me. But yes, hi everybody. I am Rachel. I am excited to be here this evening, and I'm going to talk to you guys about radiation therapists and what we do, why it matters, and how our role is really growing in some unexpected ways. So I will have time at the end for any questions. So if something pops into your head, feel free to ask at the end. I also have a QR code at the end where you can send me questions afterwards or even sign up to get these slides. So you don't feel like you need to panic scribble notes while I'm going. So make it easier for everybody. Okay, so let's see. Oh, there we go. So we can kind of just get started with the big picture. So why this matters in our profession as radiologic technologists. So about half of cancer patients in the United States, they will receive radiation at some point during their treatment. And that's a lot of people, and radiation therapists are really right at the center of their care. So our job is to make sure that the treatments are not only accurate, but they're also safe, and we're delivering that compassion for these patients. Our patients are going to trust us to really guide them through the possibly one of the scariest times in their life. So now this is now like the traditional role of a radiation therapist is already really incredibly important. So there's a really exciting part that our role is even starting to expand. So beyond so when you think about it, technology by itself, it's just a machine. That doesn't mean anything if you don't have a skilled, caring radiation therapist behind it. So we're really the ones who are delivering the treatment and giving that hope to our patients. There you go. So kind of already did my introduction, but I am Rachel Ward-Nowak now. I did go to school in Michigan and then started my career in California. And so when I started, there weren't as many jobs for radiation therapists as they are now. And finding one was a little bit tougher, so I did have to relocate right after I graduated. So I took a chance on something a little bit different, and I accepted a position to work with superficial radiation in a dermatology setting. It wasn't exactly the traditional route, but luckily I did it, and now I've been happily doing that for the last 7 years. So I am also on social media as Rach the RTT. I'm not here to convince you to follow me or do anything like that, but I just bring it up because when I started sharing what I was doing online back in 2020, I had no idea what that was going to lead to. It was really just a little side project that I was doing during the pandemic to keep busy, but it turned into hundreds of conversations with people curious about radiation therapy, students who were trying to consider the career, or technologists that were wondering about different pathways they could pursue, or even just other radiation therapists who wanted to just learn about what it was to work in dermatology. So that willingness that I had to just share things online ended up being honored by the ARRT as the gold standard for 2021 for advocacy. So it was really a big moment and really meaningful to be recognized by one of the professional societies for that kind of achievement. So this presentation really is a reflection of those conversations, that what people have asked me, what they have wanted to learn, and what I've been able to share along the way. So I hope you'll see it as a mix of education, some real life perspective, and hopefully just a little bit of inspiration of where this field could possibly take you. So, when you are choosing a career in healthcare, it's more than just what looks good on paper. So, you've got to ask yourself, can I really see myself doing this every day? Do I enjoy patient interaction? Do I like technology? And let's be honest, can I handle stressful situations without completely losing my mind? So, you need to really do your research and use reliable sources and even job shadow if you can. And we all start somewhere. So I accidentally stumbled upon radiation therapy by complete accident. I was originally studying to become a pharmacist. I quickly realized when I started my first year of school that I absolutely hate chemistry. And that's kind of a problem if you want to spend your life working with it. So I did start to explore other options. So that is when I found the similar occupations section on the Bureau of Labor Statistics website. So that gave me a list of careers with some basic information and that's where radiation therapy showed up for the first time. So what you see, these hot pink pieces of paper, this is actually what I used back then as my process of elimination to figure out what career path I was going to pursue. It's not exactly the most glamorous or insightful way to pick a career, but it honestly, that's all I had to go off of. And that's really where the problem was the Bureau of Labor Statistics gives you the numbers and the facts, but not really the real story about the career. So that is why I started sharing my experience on social media years later. I wanted to kind of share those answers that I wish if I would have had when I was searching. Things like, what is the day-to-day life actually like? What can I do with my degree? And that's what we're going to get into here. So, according to the Bureau of Labor Statistics, radiation therapy is defined as a medical specialty that uses ionizing radiation to treat and cure malignant disease. The BLS explains that radiation therapists are an integral member of the cancer center team, working alongside of radiation oncologists to deliver prescribed courses of treatment. Now, that's not wrong, but that's also not the full picture. So the BLS, it does what it's meant to do. It's giving you a labor-focused snapshot, but their description really hasn't changed since the first time I looked at this in 2015. And the reality is that this field is constantly advancing and evolving. So, what this definition doesn't capture are really all the remarkable skills that radiation therapists bring to the table. We are positioning a living human being within millimeters of precision every single day, often multiple times a week. So, we're delivering these high doses of radiation directly to a tumor while also protecting all of the nearby organs and tissue. We understand that how radiation works in the body, but we're also able to explain that to our patients and their families in a way that they can actually understand without being fearful of it. And honestly, most of that happens within the first 10 minutes of a shift. So, yes, the BLS is going to tell you what radiation therapists are, but it doesn't tell you what the patients trust us to, that the patients are literally trusting us to aim invisible beams of radiation at the center at the center of their tumors every single day. So it is a high responsibility, but it is also such an incredibly rewarding career. And because our patients come back after day for their treatments, we get to build really strong relationships and probably some of the strongest relationships that we see in healthcare. So the BLS also leaves out an entire group of radiation therapists who have taken a different path, like me. It's the ones who have specialized in superficial radiation therapy. So these therapists, they are treating patients with early stage non-melanoma skin cancers by delivering superficial doses of radiation. So while this can sometimes happen in a radiation oncology department, it's much more common in a dermatology office. And yes, I know what you're probably thinking, radiation in a regular old dermatology office. I promise it is up to the same standards and precautions that you would see in a cancer center. So the goal is really that we are bringing cancer center levels of treatment into a convenient and familiar setting for our patients. And our radiation therapists in this role are still delivering care with remarkable precision. We are lining up treatments within millimeters of accuracy. And while we're also focusing on our patients, giving them comfort, reassurance, and really that they can trust us throughout this entire process. So, when I talk about superficial radiation today, I will be sharing from my own experience of working as a radiation therapist with SkinCure Oncology. So, some of what I cover applies across the board, but I've found SkinCure to be a company that is really deeply committed to maintaining those high standards and staying true to their mission, vision, and values. So while I am here representing my own experience, my goal is really educational. So I just want to give you that clear picture of what this branch of radiation therapy involves and why it's exciting and a growing part of our field. So, radiation therapists, we also wear a lot of hats, and the Bureau of Labor Statistics gives you the basics. We collaborate with the radiation oncology team to deliver precise treatments. We specialize in localizing tumor volumes and help with imaging during treatment planning, and we provide ongoing patient education throughout the course of care. But here's what the list fully doesn't capture. As a radiation therapist, you're also a patient advocate. So patients may only see their doctor or their nurse once every 5 treatments, which means a lot can change in that time. So it's often the radiation therapist who is going to notice skin reactions early. We can manage bandage changes, check-ins on their pain or nutrition. And those check-ins that we really get to see our patient every day and just monitor how they're doing throughout their entire treatment. And as you can imagine, with that level of responsibility comes a huge amount of trust. So patients are battling cancer. This is their life and for their loved ones, and you're part of that fight with them. So it is really rewarding, but it also has that emotional heaviness with it. Burnout is a real concern in this profession, which is why self-care isn't just nice to have, it's really essential for us. So to take care of others, you really need to be able to take care of yourself as well. And burnout was a big consideration that led me to pursue a career in superficial radiation, and it really changed my perspective on all of it. And in this role, radiation therapists are not just treatment providers, we're also the patient's key advocate and educator for both that patient and that dermatology practice. So it may sound simple, we're just treating skin cancers, but here's the real challenge. In many offices, you are the only radiation therapist there. You are the one delivering the treatments. You are educating the patients and some of the staff. You're explaining diagnoses and treatment options, and you're making sure that these patients fully understand the treatment and are giving that informed consent about their healthcare. And doing that while collaborating with these dermatologists on every single case. So, a lot of responsibility, but also incredibly rewarding. And the payoff is one of the nicest things we get to see in superficial is we have over a 99% cure rate. So, I get to look these patients in the eye and say, this is cancer, but this is not going to be something that takes your life. We will treat it and you will move on. And in that moment, you really get to see that relief, and that's everything. So, even in those rare cases where we do have a patient who may not get a cure from superficial radiation, we have highly effective backups like a surgical removal. And with that kind of reassurance and that certainty, this isn't something that you get in traditional oncology. So for me, that was a big decision in going into the field for superficial. So, becoming a radiation therapist takes more than just learning how to operate the equipment, and you really need to have kind of some specific qualities in order to succeed. So, compassion along with empathy, because we are working with people who are facing cancer and other serious illnesses every day. Being able to genuinely care and listen and support them is just as important as the technical side of the job. We have to be able to pay attention to detail. Radiation therapy is all about precision. We have tiny margins that are going to make a huge difference. So, accurate measurements, correct positioning, and following exact instructions is truly non negotiable. We also have to have interpersonal skills. So, patients are going to see us more than any other person on their care team. So, building trust, being able to explain the treatment in a way that they can understand, and collaborating with doctors, nurses, physicians, it's so critical for the job. And this is a high tech field. So, operating complex machines, using different software and imaging systems is all part of our daily routine, and you have to be comfortable in mastering that technology. And so, while all those qualities carry over to superficial radiation, there are a few other things that are essential when you're working by yourself, like effective time management becomes absolutely critical when you are working independently. So, being able to balance responsibilities, staying on schedule, and maintaining patients efficiently is part of what's going to make you successful in that role. And at SkinCure, there are supervising radiation therapists within the company, but they are not overseeing your daily workflow. So that means you have to be self driven. Independence can be both empowering and challenging, and it really depends on your personality. So for me, working alone was a huge advantage. I loved having control over my environment, organizing my day, and focusing without constant interruptions. So if you thrive on that autonomy, you can really keep yourself on track, and you'll probably find this type of work incredibly rewarding. But if you do prefer constant collaboration or a need for frequent direction, it may take some time to adjust. And so the BLS says that radiation therapists are usually going to have regular work hours because treatments are planned in advance. And that's mostly true. But for anybody who has worked in a radiation oncology department, we know that those last minute Friday afternoon add-ons always somehow seem to happen. So in a traditional radiation oncology department, clinics and outpatient centers, hours are generally going to be pretty standard. Sometimes they will split into AM and PM shifts to handle a larger patient volume. But you'll work as a team, you'll learn from peers, you'll operate different types of machines, and you'll see a wide range of patients and different cases. In these settings, it's really busy, structured, but a really great learning environment. So, superficial radiation offers a completely different pace compared to traditional oncology. Therapists are typically in a setting of a regular clinic hours. No 5 a.m. starts, no late night shifts, no on-call weekends. That's at least how it is with skincare. We have very dermatology, nice, convenient hours, to be honest. And so radiation therapy jobs, they kind of look different depending on the setting, as I'm sure you can kind of tell. So hospital-based roles are often going to come with some extra layers of complexity. So we'll have to follow more regulatory compliance with groups like JRC and JCO. We have to handle emergency cases, there's on-call weekends, and the pressure of ensuring that inpatients are going to still receive their treatments in a timely manner. It's it's a more fast-paced environment, and it's usually pretty high energy. So, but not all traditional roles are going to be in those large hospitals. We do see the traditional radiation therapy role in smaller outpatient centers, and those are typically a much more calm atmosphere with fewer patients, but it can also mean that they have less equipment, fewer peers, and more independence, which can be a steep learning curve, especially for somebody who's new in the field. For each environment, you're going to have those trade-offs, and finding what is the right fit for you is really about understanding what pace and atmosphere you work best in. And so a common question we get is about the work environment is safety. So it's important to know that radiation therapy is actually a very safe career. So despite the name, therapists are not exposed to harmful radiation while we are treating patients. We deliver treatments from outside of the treatment room or the vault, which is built in a thick concrete or lead walls. Some even have maze-like entrances to ensure that scatter radiation is going to dissipate before it reaches an occupied area. On top of that, we have interlocks that are going to prevent the beam from being turned on if the vault door is open. We also wear dosimeters to track exposure, and in my entire career, my dosimeter has always read a lifetime occupational exposure of 0. So the protocols work, and they are going to ensure that safety for both the radiation therapists and the patients. So in superficial radiation, things work a little bit differently, but safety is still the top priority. So as I mentioned, my lifetime dose is 0, so that is still true here. So energies we typically use for superficial are going to be between 50 and 100 kV, which means we don't need those massive concrete vaults or maze-shaped hallways like traditional radiation therapy. Instead, we take a standard doctor's office exam room and we create a shielded treatment vault, and we call it in-suite shielding. So these rooms are built to meet strict standards that are set by the National Council on Radiation Protection and Measurement Guidelines and follow the ALARA principles, of course. So even in this setting, the radiation therapist is still going to operate the machine from a treatment console outside of the treatment room, maintaining that same level of safety that you find in the hospital. So the setup itself is really like a cancer center just condensed into one treatment room. It's a much calmer environment, but really it's all the same professional, and everything is taken care of and making sure that we are doing this all to the highest standard of quality and safety. So, radiation therapy plays a huge role in cancer treatment, obviously. So, as our population ages, cancer rates are expected to rise, which means that there is going to be a continued demand for radiation therapists. And that said, new technology is making treatments a little bit more efficient. So, patients often will complete therapy in fewer visits now. So while there is a growing need for radiation therapists, it's not skyrocketing for traditional. So according to the Bureau of Labor Statistics, employment for radiation therapists is projected to grow about 2% from 2022 to 2032, right in line with the average for all jobs. So that translates to roughly 700 openings a year, most of them due to retirement or people leaving the field rather than opening a brand new position. So, one interesting thing about radiation therapy is that many radiation therapists don't start their career here right out of high school or college. So, a lot of them come from radiology or other imaging backgrounds, which is why the average age of a radiation therapist in the US is about 40 years old. So, it's a career that really attracts people once they've seen the impact that they can have. One other thing that the Bureau of Labor Statistics didn't catch up with in their a little bit of outdated data is the rapid growth of image-guided superficial radiation therapy. Right now, SkinCure Oncology alone has 425 locations that offer IG-SRT. And that means we need at least 425 radiation therapists to staff those sites. So beyond that, we do employ radiation therapists as per diem coverage specialists, regional managers, recruiters, operations leads, implementation experts, and trainers. So with patients increasingly seeking non-invasive treatment options, the demand for IG-SRT is skyrocketing. So the job outlook for radiation therapists in this field is projected to grow by 120% over the next 3 years, which is really a reflection of both the effectiveness of IG-SRT and how quick it's being adopted by the dermatology community. So, for students entering the field, this really represents a huge area of opportunity, not just for stable employment, but for career growth and a rapidly expanding area of cancer care. So, as of 2023, the mean hourly wage for a radiation therapist was about $50 an hour, or roughly $104,000 annually. So, where you work is going to make a difference. Outpatient care centers had the highest mean wage at $63 an hour, or $131,000. Specialty practices averaged about $114,000, and hospitals, who do hold the largest number of employees, came in at 103,000. So, experience and geography also will play a big role in that. So, that $104,000 mean, it's not universal. In some states, especially in the Midwest, average wages fall much below that mark. The lowest 10% of radiation therapists earned an estimated $72,000 a year, while the highest 10% earned $137,000 a year. So, while this is a solid paying career overall, it's important to consider that your location, setting, and career progression when you are thinking about those potential earnings. And just a reminder that this is not my data. This is something that is just available on the Bureau of Labor Statistics website. So, if you did want to look into these more in depth, this is something that's just publicly accessible. And obviously, that's because pay matters. And working in superficial radiation therapy does not lessen your value as a radiation therapist. So, at SkinCure Oncology, our salaries are competitive and based on experience because we recognize that both general radiation therapy skills and specialized experience is important in our field. So, just like a traditional role, there is room for growth here. Therapists can advance into positions like lead therapist or a clinical training specialist, even to leadership. Our company's co founder and COO are both radiation therapists, which is really rare and you don't see that much in hospital systems. So, what do you actually need to be a radiation therapist? So, the Bureau of Labor Statistics makes it sound optional, but let me tell you, these requirements are non negotiable. So, first, you need to complete a radiation therapy program. This includes coursework in treatment procedures, radiation physics, anatomy, and hands on clinical training to prepare you for the real world. So, when you are looking for radiation therapy programs, there is accreditation by the Joint Review Committee on Education in Radiologic Technology, or JRCERT, and that is going to be the highest achievement for a radiation therapy program to hold. So, these programs are going to meet strict standards from qualified faculty to strong board exam pass rates. And you can tell a lot about the education and training you will receive from that accreditation. Some programs aren't going to have that accreditation, but are still going to be able to be recognized as eligible programs by the ARRT. Because next, you'll need to pass your ARRT board exam, which is required to work in the United States as a radiation therapist. So, our licensure requirements will vary by state. Some states may require you to apply for additional certification, which may involve extra exams or fees. And the ASRT website is a great resource for finding those and what you need and to work wherever you are looking. And finally, like most healthcare roles, you will need to have your CPR and basic life support certification because emergencies can and do happen. One of the most common questions I get, though, is do I need a special license or certification to work with superficial radiation therapy or with IG-SRT? And the answer is no, and it's a really common misconception. So, once you have met the standard requirements to become a radiation therapist, your education, ARRT certification, and those state licenses, you are set. There is no additional certifications required for image-guided superficial radiation therapy. All of the training you need will be done on the job. So whether you are a brand new grad or you have 20 years of experience, or even if you have worked with superficial for a different company, you will still go through the same full clinical training. So that way we know everybody is operating at that same high standard and of safety and quality. So that is everything I could learn from about becoming a radiation therapist through the Bureau of Labor Statistics. But what that really didn't tell me was just as important. So it didn't explain how I was going to land my first job, how I could network, or that I would eventually have to choose a specific path within that field. So, starting out can be tough, especially when the job market is not on your side. So, for me, that meant moving from one state to another to get my first job. And I did start in private practice. I picked up some per diem shifts at a large hospital, and I even started to onboard with the Long Beach VA. And so I liked the work, but none of the roles really felt like that was what I was meant to be doing. So when I did see the first posting for a dermatology office hiring a full-time radiation therapist, I had honestly thought it was a typo. I didn't understand why they could possibly need a radiation therapist full time. So I went for an interview, and in that moment, it really forced me to consider what I wanted out of my career. So, do I stick with the private practice? Do I wait for a full-time position at the hospital to open up? Do I take the government job? Or do I just ignore everything everybody is telling me and when they were all telling me to stay traditional, and do I leap into this completely new realm of superficial radiation? So if I had a crystal ball, it would have saved me a lot of stress, but that decision ended up shaping everything I do today. So truly just do what is best for you and do not let other people stop you from doing it. So that is where we really get to my career. Something completely new to me when I started out was superficial radiation, and it really changed my career. It showed me that stepping outside of the traditional path could open doors that I didn't even know existed. So, let me introduce you to my world of SRT, which is superficial radiation therapy. And when we add the ultrasound image guidance into the mix, we call it IG-SRT, or Image-Guided Superficial Radiation Therapy. So this specific system that we are currently using across the country is the SRT 100 Vision by Census Healthcare. So you may be wondering, wait, where does ultrasound come into play here? I thought we were talking about radiation therapy. In IG-SRT, the ultrasound is not a regular diagnostic ultrasound. It is a high resolution dermal ultrasound designed specifically for skin cancer treatment. That is going to allow us to see 6 millimeters into the skin and really give us a detailed look at the tumor borders and depth. So, this is going to become our onboard imaging for this unit and assuring that we are targeting the tumor with our accuracy, and in real time, we get to see the changes to that tumor. So, this level of precision is really what's going to make IG-SRT such a powerful and exciting tool in modern skin cancer care. But IG-SRT is not a groundbreaking new treatment. It has been around for over 100, superficial has been around for over 100 years. So even Mr. Röntgen himself used radiation to treat skin lesions. The photos you see here are the first person to be treated for a skin cancer on the tip of her nose. She underwent 99 treatments over the course of 9 months. She did live, and she also remained tumor-free. She even attended an X-ray conference 30 years later, still tumor-free. So thankfully, our techniques have come a long way since then, and nobody is any longer getting 99 treatments. But technology obviously has improved a lot since back then. So patients really get to see that less invasive treatment, and radiation has made a comeback. It used to be used in dermatology offices all over the country, but it kind of lost its way when surgical innovation kind of took over. So now we get to see superficial making its comeback and coming back with proven history and more technology to match. So this technology matters so much because skin cancer is the biggest problem of the largest problem for cancer we have in the United States. Skin cancer is the most common type of cancer, and about 1 in 5 Americans will develop that in their lifetime, which translates then to about 3 million cases of non-melanoma skin cancer each year. And so the problem though is also for these patients, once you've had skin cancer, your chances of developing another one go up. So it leads to over 5.4 million diagnoses each year. So even with all of this, the awareness we have around sun protection now, why do these numbers keep rising? And it really goes with improved detection that's going to play a role. So a good thing, but it just makes those numbers higher. We're catching them earlier. And so people are still going to spend too much time in the sun, but people are also living longer, which increases their lifetime exposure to the sun. So this landscape for IG-SRT, that's what it was built for. We have that growing need, and we need a safe and effective non-invasive treatment option for all of these skin cancers that are popping up. So we can talk about what a common skin cancer is. So skin cancers happen when there is an out of control growth in abnormal cells in the epidermis, which causes DNA damage that triggers a mutation. So there are two main causes of skin cancers: UV exposure, which can come from the sun or tanning beds, and unfortunately, the other one is just genetics, a skin type, and your family history. So we do focus on non-melanoma skin cancers, and these are going to be the skin cancers that are not melanomas or don't originate from melanocytes. And the two most common types of skin cancers we see are the basal cell carcinoma and squamous cell carcinoma. So before I show you the next slide that shows you what a tumor looks like with this, it's important to understand what the healthy tissue looks like on these high-resolution dermal ultrasounds. So a good image should include a visible membrane, and that is the ultrasound probe itself. So there's going to be your nice gel layer, that's that black strip you see, and then we're going to have our epidermis, which is usually going to show up pretty bright. Then you're followed by your dermis, then your subcutaneous fat, and then the fascia. Sometimes, depending on where you're looking at, you'll be able to see a little bit of muscle. So this is really just that baseline. So it's what our radiation therapists and our providers need to be able to understand to then be able to locate these tumors. And so this is what it looks like to see a nodular basal cell. And this one, the first one is by this patient's ear. So when we are treating, we're not just targeting that visible tumor. We are treating that tumor as well as the margin around it and able to make sure that we're getting it at its deepest points. So on that ultrasound, you can see that clear black area that is abnormal to what you saw in the healthy tissue. That is that basal cell. So a CT scan or an MRI is likely not going to give us this level of detail that we need for planning these superficial treatments. And so this other one you can see by this patient's eye really is such a small lesion. And it really gives you that appreciation for how small some of these lesions that we're able to treat are. Because if you think about the alternative, this patient would have to have that skin cancer removed surgically. So then they would be going through a surgery, and a surgery that close to the eye. There are some extremely skilled surgeons out there, but when you're removing tissue from somebody's lower eye, there's some things you can't avoid. Maybe the skin becomes too tight now, and this patient's no longer able to blink properly and may have to use eye drops for the rest of their life. So instead, we're able to do this where we're preserving that tissue and really understand why it's becoming such a preferred method by the patients especially. So here we have a couple more examples, one on the chest and another one on the lip. These are squamous cell carcinomas, and you can see where that physician has designated that treatment field and what it looked like on that ultrasound. So these ones are a little bit more aggressive. So with these high resolution dermal ultrasounds, we're able to confirm the deepest point of these skin cancers and making sure that we're able to eradicate that whole tumor with our treatments. And it's not about just that we're able to eliminate these tumors, but we're able to do this in areas that when you remove that tissue, it's so hard to mimic that without leaving a scar behind, especially something like the lip. That tissue, if you remove it, it's not going to grow back. So those patients are then left with a permanent disfigurement for the rest of their life. So we're able to do this without disrupting that. So with IG-SRT, we have over a 99% cure rate. It's just as effective as a surgical option, but with less invasiveness. And our patients are typically going to come in for 2 to 4 treatments per week for about 20 treatments. Each treatment appointment is going to take about 15 minutes, but the beam on time is usually about 30 seconds. The rest of that is just patient education, the ultrasound, and finding out what they're doing with their life this week and whatnot. Um, but these are really going to be able to give us those appreciation for IG-SRT because for these patients, a lot of them have already been through this. The alternative to IG-SRT is currently surgical excision. And the most common type of surgical excision is a Mohs micrographic procedure. So that involves a trained dermatologist who removes tissue, immediately has it prepared on a slide to view under a microscope. They are going to continue to remove tissue until their margins no longer contains cancerous cells. This can take hours. The patient is awake the entire time, and there is often a need for reconstructive surgery or skin grafts to follow. After working in dermatology, my biggest issue goes a little bit beyond that, is that I've seen so many patients not fully understand what the procedure entails until they're finished and looking at a bandage covering half of their face. So, for example, this patient here may have had a skin cancer that was maybe the size of a dime. So, after they removed all of that tissue, they now have this large circular deficit. Well, you can't just pull this tissue together, it would pucker. So instead, they have to do what's called an O to Z procedure, where they take this O shape and they extend it along the lines of the face. The goal is that they're going to hide these scars within the natural lines of the face. But for this patient who walked in with something so small, she is now literally walking out with a bandage covering half of her face. So I've seen it be a very overwhelming and emotional and traumatizing experience for a lot of patients. So, with radiation, we still do have side effects. We're not going to be covering people's faces with bandages, but we do have some redness, and that is part of our job as the radiation therapist to talk our patient through this and educate them on what is happening with their skin. So we know that the skin is often going to look a little bit worse before it looks better. That radiation causes redness, irritation, changes in the color of the skin, or sometimes damage to the glands or hair follicles in that treatment field. But that is all normal to us, and we are able to help ease these patients through this and give them recommendations for proper skincare. So at the end of the day, that's part of our role and why we are so much more than just button pushers in this setting. We are making sure that these patients have the support, and that can really make all of the difference in how they experience this treatment. And another advantage of IG-SRT is our patients are truly going to appreciate that they can have more than one lesion treated at a time. So with a Mohs surgery, they only are able to usually do one at a time, which can usually be months and months of surgical removals. So here this patient had 2 large lesions on either side of his face. He had them both treated during the same appointment. Each took about 30 seconds, and you can see the huge improvement on the skin and on the ultrasound. Some scarring is normal when that tumor has had time to erode the tissue prior to starting treatment, but the outcomes truly speak for themselves. And so, with all of our patients who go through IG-SRT, they don't have to limit their daily activities. There's no downtime, no surgery, and no skin grafts. So it's a really non-invasive treatment that allows them to just go on with their daily lives. So it really makes it rewarding. We get to help patients without having to have them sacrifice their quality of life. And in this setting, we really are functioning at a advanced level. So there's a lot of responsibility, yes, but it comes with a lot of autonomy. We are essentially running our own mini radiation oncology department right inside of this dermatology office. And that autonomy gives us something incredible. We get to form that deep, meaningful relationship with our patients. We're there from their first consultation and their simulation all the way through their treatment and to their follow-up. And we are always that point of contact for them. So that consistency and builds that trust, and trust is everything for cancer care. And it means that our patients are really getting that expert and that compassionate care every step of the way. And we get to make sure of that. Because honestly, who wouldn't trust a radiation therapist? We are pretty great. With all of this though, our advanced roles and building the relationships, it's always about the patient for us. So it's one of the things we always say is that it's first and always about the patient. So no matter what else, they are our priority. So we are currently in doing this treatment in 425 locations across the country. And for these patients, they call this the gentle cure experience. So, gentle cure is more than just a name for the treatment. It's really a commitment to making sure that everything the patient has access to is clear and balanced and informed about their treatment options. And as professionals, we are making sure that these patients get that compassionate and consistency from any location that we are delivering this treatment at. So we have a complete site called gentlecure.com, and that is going to allow these patients to go learn about these skin cancers, get those educational resources, see real testimonials from patients, and even a helpline to talk to somebody to go through their options or find a clinic nearby them. So it's just another thing that as a radiation therapy um, founded company, something that we valued in having those options and education for our patients on such a large scale. But that is what I've got for today. So hopefully that you get to kind of see the impact we have in radiation therapy, not only in traditional cancer centers, but also in these innovative settings like IG-SRT, and how we get to really change how things look for our patients. And I am happy to answer any questions you guys have. And if there's anything ever later, or I can share the slides with you guys as well if you want to distribute them along. But thank you guys for having me.
Hey, thank you, Rachel. This was super informative. I truly had no idea about this, and having a lot of like family members who've experienced skin cancers. I wish I would have known about this. So
Yep.
I did have one
Now you
question.
know. Yep. Go ahead.
I kind of had a couple questions. My first one was, how are insurance companies currently viewing IG-SRT, like in terms of coverage compared to surgery?
So right now, so if a patient goes to go into a or a dermatology office, say they have Medicare, because we know the majority of people who are dealing with skin cancers are typically above the age of 60. So let's say they have Medicare and a secondary insurance. Medicare is going to cover it, and the secondary insurance is going to pick up the rest of it. So it's a very good coverage for them. We do start to see a little bit of an issue, not so much in the coverage, but with what patients are paying out of pocket with things like a Medicare Advantage plan or those commercial insurances. But
Hmm.
overall, we do have a very good coverage of with this treatment. And we do have with SkinCure, we do have a team that is going to verify patients' benefits. So ahead of time, they get to know what that kind of out-of-pocket cost they're looking at is.
Hey, that's so cool.
Yeah, it's really nice. When I first started, I was not with SkinCure when I first started in superficial. So I was doing all of those trial and error of billing insurance on my own. So now that SkinCure is established and we have that big support system, it's so much nicer. Appeals are no joke.
Yeah, yeah. Oh, well, good. And I guess my other question, you've already kind of answered it with some of those slides of your patients' kind of outcomes. But I guess have you heard any testimonials from them about like the comfort or the like recovery process of going through the procedures as compared to
Yeah.
surgery?
So typically we see our patients 4 to 6 weeks after their final treatment for their follow-up. So we will do an ultrasound after that to just make sure and plus, I mean, it looks pretty cool to them because they do get to see these ultrasounds throughout the treatment course. So at the end, when we show them their follow-up and you can see that that black area is no longer visible on that ultrasound, it's really rewarding for them and reassuring. But typically it's going to be pretty straightforward. They're going to have that redness and erythema probably at the peak during that middle portion of their treatment, and it starts to fade within about 30 to 90 days once they've completed that last session. So it just depends on how fast they heal, and in areas where maybe it's on their cheek, and if they're out in the sun a little bit more, it's going to take a little bit longer for that redness to go away, especially if they're not protecting it. But typically we see it happen pretty quickly. There are, of course, going to be those cases where it does break down a little bit more. We see the dry desquamation or the moist desquamation start to happen. We will
Right.
put patients on a break. Usually the break is about a week just to allow for that skin a little bit more recovery time. But
Do
typically they won't have much downtime at all. Whereas when they do a Mohs surgery, typically the uh, healing process is about 6 weeks. So I used to treat a lot of golfers, and so that meant 6 weeks. If it was on their shoulder, 6 weeks that they
uh,
couldn't go golfing.
okay. And then are there any like prior radiation limits to possibly future treatments? Like, for example, my mother-in-law is dealing with the kind of skin cancer stuff, and I didn't know if there's any kind of limit to the number you can do, or what does
Yeah.
prior radiation limits, how does that affect it?
Yeah, so we won't treat a location that has already been radiated at if
Okay.
there is a recurrence and they are not able to we're not able to deliver any additional dose to achieve that therapeutic goal, we will
Hmm.
have to then refer them for surgery.
Hmm.
If, say, we've seen patients where maybe they were treated for a head and neck cancer in a radiation oncology department. Now they're coming in and they have a skin cancer on their cheek. We will do our best to pull records from the radiation oncology department, and we do have grand rounds where we are able to present a case and we have a team of a radiation oncologist and a dermatologist who is board certified for everything and trained in radiation superficial. And they will evaluate these patients and determine, is it appropriate to treat with radiation or is that going to exceed the total dose that we're able to deliver to an area? Because the skin never forgets. If you deliver a dose, it will always remember you can never deliver more. You can never exceed we don't exceed a threshold of 66 gray.
Okay, okay.
So typically we can even get really close where say somebody has a skin cancer and then another one pops up next to it. As long as those borders don't overlap, we're able to treat multiple lesions. I used to alphabetize my sites. So site A, B, C to keep them in order. I have treated people all the way to the lower parts of the LMNOPs. So
Okay.
there's no limits to how many we're able to treat. It's more just how many we can treat at a time. Um, Schedule permitting, usually it's maxed at about 4. I have seen more, but that's up to the dermatologist.
Mhm.
But we also, um, it's not something that their insurance isn't going to cover after a certain amount because it's a cancer and it needs to be taken care of one way or another.
So cool. I truly had no idea. That's awesome.
Yeah, I mean, so the Gentle Cure website got a ton of information, and we've tried to really make it so that they get to really learn quite a bit. But we did just do a campaign where a lot of our radiation therapists recorded clips from their patients and we asked them why they chose this. And so we did 100 patients in 100 days. And it's currently every single day we post one of those videos and they have the cutest answers of why they chose to do this and what made them do it and what was the reason for them. So we just wanted to make it relatable. And I mean, hearing it from another person who's in that same situation is a lot more relatable than hearing it from somebody who's working in it.
Sure, sure. Well, I don't mean to hog all the question time. Students, if you guys have any questions, feel free to put them in the chat or go ahead and unmute and ask. Also, students, please in the chat put your name, your email, your school, and your graduation year so that we can have record of that as well. But once we get your information in chat, if you have no further questions, you are free to head out. Thank you again for coming in and listening to Miss Rachel give her presentation. I learned a lot. Hopefully you learned a lot. And we'll stick around for a few more minutes. It was great to have you. Thank you.
Thank you guys. I tried to get the chat open. I didn't see any questions. No.
Yeah, I was keeping an eye on it. I didn't see any questions
Yeah, I
either.
didn't show while I was presenting, so I wanted to make sure that
Uh,
any. No,
Yes,
I
yes.
do. So I do a presentation for IG-SRT for the radiation therapy students. And I
Hmm.
go in depth because at that point, they are radiation therapy students and they have the basics of what we're doing and how to compare the two. So then I was trying to break it down. So I was like, for somebody who might not have as much background in therapy yet, what do I need to cover? Because I feel like sometimes I just assume everybody knows what I'm talking about.
Hmm.
So
Hmm.
I'm trying to make it make sense to every level.
No, it's really cool. And like I said, I just had no idea. And sometimes it just boggles my mind. I feel like I've been in healthcare for so long and there's still things that I'm like learning all the time. And
Oh yeah. I mean, even we do grand rounds every Friday, and
hmm.
all of our radiation therapists get to log on to a Teams call, and these two physicians will we present all of our cases to them. The amount of stuff I learn every Friday is insane. I've been doing this since what, 2018. And every I'm like, really? Like, it's crazy. I mean, there's never a shortage of what you can learn.
Oh, to be a fly on the wall in those meetings.
I don't even treat right now. I sit there just to see what's going on. Like and I've gotten asked like, well, why are you here if you're not treating? I'm like, well, I can multitask. Like I can get some of my non-clinical work done while I listen to everything that goes on in grand rounds.
Yeah, it's cool. That's really cool.
Can I ask a question? Can y'all hear me?
Yeah.
Yes, go ahead.
Okay, cool. All right, so I'm still kind of trying to find my X-ray specialty that I want to do after I'm done with school. Are there any other little niche like radiation therapy programs like what you're in?
So like the program itself or the career?
Like specialties, like how you're dealing
Yeah.
with skin cancer. Are there any others like that in radiation therapy?
Yeah, so there's a traditional radiation therapy department, they'll typically have machines that are going to be linear accelerators to treat s- things like prostate, breast, lung, brain, those kind of more standard cases for cancer treatments. But there is something that we have now there are a few different ones. We have proton therapy, which we do more specialty for things like pediatrics. And those are specialty cancer centers that are proton units. I have never actually seen a proton treatment, but I have heard incredible things about it. There is now a thing called an MR-Linac. So we actually use a MRI machine to do our image matching so that we're making sure that tumor is lined up perfectly. Those are something you kind of have to get additional training on in therapy, and you can kind of that make it like your specialty, like you're the MR Linac person. Um, we also have different things like IORT, which is interoperative. So there's people who can go into the operating room, and we usually are planting radioactive seeds or doing a brachytherapy treatment in those settings where you're going into the OR and being the radiation therapist who's treating the exposed tumor, and then you continue about. Typically, those will be people who work in the radiation oncology department, but have that extra training, and then they will go up if there's a surgical case because there's not usually a ton of them. Um, there is veterinary radiation oncology that has gotten a lot bigger in the past few years, where older Linacs are being used and purchased by vet offices, and then they're going to put usually cats and dogs, and they will do anesthesia and then do a radiation treatment for the pets. I think it's called pet cure oncology, is one of the big like branches of that in the United States. There's also people who do education. So I technically still am in superficial, but I go around and do presentations and education. Obviously, there's program directors and clinical staff and adjunct faculty. There's also Oh, shoot, I had one more. Oh, clinical application specialists. So companies like Varian, Electa, Civco, they are the big ones that um, give us the supplies we need in radiation oncology. And they hire radiation therapists as their clinical application specialists. So they may go to these hospitals and let them know about the new products that are available. Or they may, when there's a new LINAC that comes in and is installed into the hospital, there's a radiation therapist from that company who's going to come in and teach everybody how to use it correctly. Um, I think that's everything I can think of.
Hey, Kelsey, are you in a radiation therapy program or radiologic technology?
I'm in just a radiologic technology program. I just started my first year.
Oh, nice. Yeah, I mean, and then some like places you can go from radiologic technology is even there are techs that work on cruise ships. So you could work on cruise ships, like sports arenas. What Rachel said, veterinary clinics. You can get into like forensics, being an RT who does like post-mortem exams.
There was the one
Um,
guy who does the Egyptian oh,
mhm.
he did the CSRT a couple years ago. Oh shoot, what does he do? He does like digs, archaeologic digs,
Yeah,
and
stuff like industrial radiography kind of stuff. Um,
all kinds of different
yeah,
ones.
you can do that. I mean, there's theme parks, prisons, research lab, medical device companies. Some of the bigger amusement parks, like at ski resorts, they'll even have sometimes RTs on staff to do trauma stuff. So yeah, there's a lot more than a lot of times we think X-ray and we just think hospital. But no, you can do a lot of like crazy stuff with it.
That's really cool. Thank you.
If you get on a cruise ship though, let me know. And maybe you need an assistant. I'll be your assistant while you're on the cruise ship.
Well, thank you for answering that. This was a really informative PowerPoint.
Thank you. I appreciate that.
Well, again, thanks everybody for coming. I'm going to go ahead and head off myself. It was great meeting you, Rachel. Thank you for coming to speak with us, and hopefully we'll have you back again.
Yeah, anytime. Thank you guys for having me.
All right. Thanks, everybody. Have a great night.
Bye.